and welcome. I'm Dr. Eric Fethke. I am a heart doctor for children who has been practicing and teaching on the front lines in New York for the past 25 years. I am proud that I have had the opportunity to train and work in some of the most prestigious institutions in our country. I remain convinced over the years that the best approach to treating illness and disease is to teach my patients and their loved ones everything they need to know about their health care. I actually love it when the kids and their families ask me a lot of questions. I have learned to recognize that my visit with them is complete when I ask, "Is there anything else you want to know?" And they respond, "Nope, we got it, thank you." That moment in each visit feels really good. So with that philosophy in mind, let's talk your healthcare. I don't know about you, but I have never been one to remain on the sidelines. Even before this horrible pandemic, our healthcare had clearly risen to the top of our nation's priority list. Now more than ever, my patients are focused on their health. Many people are understandably overwhelmed, burnt out, or indifferent about our country's complex healthcare issues. They simply choose not to be bothered. These feelings have been made even worse during rush visits when doctors talk right over the heads of their patients, leaving them little time to ask questions. Daily, many of my patients tell me that I am the first doctor to help them make any sense of their health problems. They ask, "Why don't my other doctors take the time to explain?" In the past, I have made excuses for my colleagues. I am sorry you experienced this. I'm sure that they would have liked to spend more time with you, but healthcare today just forces them to keep moving. I actually believe that many doctors have been in the wrong because they failed to teach their patients. Did you know the root of the word doctor is the Latin word docere, which actually means to teach? Doctors should not be the only keepers of medical information. If we do not share important knowledge with those we are supposed to help, we become much less effective. I warn my students, too many shortcuts leads to missing the true problem. We make the wrong diagnosis because we do not bring the patient into the discussion. How are they supposed to get better if they do not fully understand? This isn't magic, it's medicine. Honestly, the pattern of not fully engaging the patient in their own healthcare should be somewhat embarrassing. I'm determined to break down the walls and constraints between patients and doctors. I now challenge you to not sit idle on the sidelines. Whether you are a patient or a student of medicine, step forward with me and become involved. I invite you to bother and be curious about the healthcare issues that affect us all. When you do, it shows you care. There is a lot at stake here. But my friends, together, we make a more powerful weapon against society's complex healthcare issues than physicians alone ever could. I have divided the journey we are about to take into 3 stages: empower, engage, and evolve. Empower ourselves through knowledge. Engage one another in constant dialogue that leads to action. And push to evolve our country's healthcare system to be the best it can be. We call our website's media content The Doctor's In. Here, we encourage you to be actively curious about important healthcare issues, including specific medical conditions, mental illness, substance abuse, gun violence, public health, and healthcare policies. As your guide through these topics, I promise to do my best to make these discussions exciting and stimulating. So, when it comes to the healthcare of yourself, your loved ones, and even those you may not know, are you someone who still cares to be curious? Do you still feel it is worth it to bother and spend some time and energy on these issues? Are you up to the challenge? If so, I welcome you to join me here. Together, we will make a difference.